Since March, the Ebola outbreak in West Africa has claimed thousands of lives, and all the while, U.S. health officials have prepared for and addressed cases in the U.S. I'm Erin White, and this is a health feature. So far, only 2 patients have contracted Ebola on U.S. soil. Both of these patients were nurses who treated a Liberian Ebola patient, Thomas Eric Duncan, who came to the U.S. and was diagnosed at a Texas hospital. Duncan died October 8th from Ebola virus disease, the often fatal disease caused by the Ebola virus. On October 12th, nurse Nina Pham was diagnosed with the disease, and a second nurse, Amber Vinson, tested positive for Ebola on October 15th. On October 20th, the same day the World Health Organization declared Nigeria to be Ebola-free, 43 people were taken off the Ebola watch list. They had had possible contact with Duncan and self-monitored and reported to health officials for 21 days. Ebola has an incubation period of 21 days, meaning that patients who go for longer than 21 days after possible exposure without developing symptoms are not likely to have the virus. Symptoms of Ebola include a high fever, nausea, vomiting, and unexplained bleeding. People with Ebola are only contagious when they are displaying symptoms, and the virus can only be spread through blood and other infected bodily fluids. Several U.S. health and aid workers have become infected with Ebola while trying to fight the outbreak in West Africa. Some of those workers have been evacuated to the U.S. for treatment, including Dr. Kent Brantley, a missionary doctor fighting Ebola in Liberia. Speak with a doctor about how to best avoid infectious disease.